So my name is Stephanie Freeman. I am the Memory Center Program Coordinator here at Norton Neuroscience Institute's Memory Center. Honored to be here today with a couple people I'll introduce in just a second. But this is the first of one of our three-part series, of our Capable Caregiving series. We have a good time trying to think of different topics, and these topics come from all of us brainstorming the most common things we talk about every day. And this is one of those topics. This is something that is part of a conversation I think we have with every care partner that we have, are these difficult conversations, how to address some of the tricky things with dignity and respect, but also with, in all seriousness, it's something, you know, a lot of these different topics that Tammy will highlight are important to discuss, and we want to make sure we're doing that correctly and again with grace. So again, today this is the first of a three-part series. The next topic will be on December 12th, and that's called Breaking Down Grief and Identifying Hope. So that's with one of the chaplains here at Norton Healthcare. So we're excited to have Jill with us at that time. So I'm going to go ahead and turn it over to one of our favorite partners, Erin Gillespie. She is with the Alzheimer's Association. She is the Director of Programs, and she's going to fill you guys in on what the Alzheimer's Association does. So thanks, Erin, for being here.
All right. Thank you, Stephanie, for the great introduction. Again, my name's Erin Gillespie. I'm the Director of Programs for Greater Kentucky and Southern Indiana chapter for the Alzheimer's Association. And I'm going to pull this up. So today I'm just going to talk a little bit about the resources at the Alzheimer's Association. Tammy's going to do a great job, I know for sure, talking about some of the hard topics and discussions that you'll have through this journey. And just know that Alzheimer's Association has a lot of resources for caregivers, those living with the disease. And so today I'll just talk about some of those supports and resources. And I believe Stephanie sends this presentation out after. So don't think you have to write down all these resources. I also have some quick links that will be available through the presentation as well. So just a little bit about the association. The Alzheimer's Association is the leading voluntary health organization in Alzheimer's care support and research. So, of course, our vision is a world without Alzheimer's and other dementia. And we are in an incredible space right now. We do call it the era of treatment. And so, you know, this space is evolving, and it's really hopeful for those living with the disease and our caregivers. Our mission at the Alzheimer's Association is to lead the way in Alzheimer's and all other dementias. By accelerating global research, driving risk reduction, early detection, and maximizing quality care and support. So you'll hear a lot about our care and support today, but we also have other pillars of advocacy. Walk to End Alz. If you haven't been to one, I'll talk a little bit about that at the end of the presentation. So when I talk about I'm the Director of Programs, that means care and support. So we provide care and support for our community, and that is anyone in the general public that wants to know more about brain health or the 10 warning signs, to caregivers. We know caregivers are in the thick of things, and you know, this disease can be very isolating, and we want everyone to know that they are not alone. So some of the resources that we offer at the Alzheimer's Association, it's our 24/7 helpline. I talk about this number constantly, daily to anyone, professionals, caregivers, or people living with the disease. I know it's a 1-800 number. So some people are like, is that only for emergencies, or, you know, who am I going to be talking to? So this number is for anything. It is not contracted out to any other organization or company. It is our organization, and it is people that are picking up those phones are master level clinicians. So you can get a care consultation to where you just need to know what to do next. That's often when people come to us, and there's so many boxes to check upon a diagnosis, or even when you're wondering, you know, my loved one, they're starting to see some changes. What does that look like? What should I be looking for? Who do I talk to? You can call this number. If you're wondering about treatment, what does that look like? Or even if you just need someone to talk to, We know, again, that caregivers sometimes can feel alone. And, you know, you can call at 3 o'clock in the morning on Christmas Eve just to have someone to talk to. So again, keep that in your back pocket is for anything that you need. We also offer support groups. We have over 23 in the state of Kentucky and in Southern Indiana. Education programs, we'll talk a little bit more about those. Early stage programs, we know that when you get a diagnosis, it's kind of a unique stage. You're dealing with grief, you're dealing with what do I do next? What is this going to look like? So our early stage programs are, again, unique to where the person living with the disease comes to our early stage groups and the care partner. And so once they get there, they network and socialize, but then they break up into two groups. We know it's important that people can talk freely and openly. And so they come together, but then they also can be in a room with other people that are going through similar journeys. We do physician outreach, we have a caregiver center. We know that oftentimes there's barriers in transportation or just limited time when you're a caregiver. So we do offer everything that we have online. So it's at the tip of your fingers 24/7. And then we have professional development and resources. This is a very busy slide. I'm not going to talk about all of it again. You will get these snapshots and you'll have this later. So I will talk about a few things. I've already talked about our 24/7 helpline, but our community resource finder, it is a great resource for anything from in-home care if you're looking for some respite, which is incredibly important for caregivers' health, and or if you're looking for a diagnostic center. Really even an education program or support group, and everything is by zip code. This is why this community resource finder is so helpful, is because even if you're caregiving from afar and you're not really sure about the resources that are available for your loved one that maybe is living in a different town, maybe even a different state, it is pulled by zip code. So again, pretty much anything community service or health you can find on our community resource finder. I also want to talk a little bit about our ALS Navigator. You know, I talked a little bit earlier about an action plan. What do I do next? And maybe you need an action plan on different topics. We're going to be talking about doctor visits. What do I talk to my doctor about? When is it safe to drive and when is it not? Every person is different. We know that every person living with the disease is different, and so is the caregiver and what they are dealing with. So you can go to our ALS Navigator, answer questions that are specific to your needs, and then it prints out a personalized action plan. So this is very, very helpful, very user friendly, and again, is available virtually. And finally, I will talk a little bit about our website. You'll see some snapshots today. Our website is incredible, but sometimes can be a wormhole. So it's really nice if you go to alz.org/KYIN, that is our local chapter. And so you can find all our education programs, all of our support groups, but also any other resources that are available for caregivers, for healthcare professionals. So again, it's a really nice, just a direct link to our specific chapter. So caregiver, this journey looks different in every single stage of this disease. And so we know that as an organization and our partners. And so we want to make sure that you have the information that you need at every step of the way. So we do have a caregiver specific website that can tell you what to expect. What am I going to expect, upon a diagnosis or in the early stages of the disease? What are those treatments? How do I get support? What does that community support look like? Daily, your day to day. We sometimes can't see the forest through the trees because we're working on day to day things. And so, what does that daily care look like? And care options and planning. We know, people come to us, well, when should I start planning for the future? You want your loved one to be part of those discussions and part of those processes. And so so looking at those care options and planning is really important to do today and not wait. Tammy's going to be talking a lot about these hard discussions. Talking about memory problems is difficult. And sometimes it's just breaking that ice can be challenging. And so we do have a lot of different resources that can help you. Anywhere from you're seeing the early, you're seeing some differences in your loved one. What does that look like? How do I talk to them about it? To what is Alzheimer's disease? There's a lot of stigma around this disease. There's a lot of misconceptions about, dementia is an umbrella term, and Alzheimer's is under that umbrella and is about 60 to 80% of all cases. And I will note that the Alzheimer's Association, a lot of people say, do you only work with people with Alzheimer's? No, we work with anyone with any kind of cognitive impairment. So that's any kind of dementia, MCI, things like that. But this specific website kind of gives you a direction of, what is the benefit of early detection? How do I have those conversations? What do I talk to my doctor about, which is incredibly important. So a lot of times people come to us and they're like, I want to talk to my doctor, but I don't know the questions to ask. So this helps you direct some of those conversations and discussions. The Alzheimer's Association does provide free education virtually and in person throughout the state of Kentucky and Southern Indiana. And one of our new programs is the Empowered Caregiver. This was reviewed by over 400 caregivers. It is about person-centered care. And so, like I was talking about earlier, everyone is different in their journey. We might have certain trends that look similar, but everyone is different. So we all of these programs really talk about building the foundations of caregiving, managing that caregiver stress, supporting independence of your loved one. Stephanie was talking about still approaching this with dignity, and how do we do that? And then communicating throughout the different stages of this disease. It will look different, and understanding those behaviors. We know that a lot of times those communications and those behaviors, if you know more about it, it can reduce your stress, and then you can get the support you need too. But, knowledge is power, as we have always said. And so understanding some of these things that you may deal with through this journey is very important, and knowing that you're not alone. These also come with activities that you can really pinpoint on what works best for you and your loved one. And so again, all these are available virtually and in person. Um, One of the things that I talk to with professionals and also our caregivers is our publications. And so these are all printable PDFs. And so this topics that may come to mind you know, um, that you need information right now, and or you want to talk to your family about safety. What are the holidays going to look like? We have publications about holidays, how to include your loved one, visiting the doctor. It gives you kind of a checklist of things to ask. What are the new treatments? What does that look like? So again, all these are printable PDFs so that you can share, so you can print out, so you can have at your fingertips. And I'll be honest, there's probably over 100. So if you can think of a situation like bathing, it's probably there. Finally, we do talk about some of our support groups. I talked about that earlier. And, I think of our support groups, sometimes people are like, ooh, support groups, I'm going to have to go and, talk the whole time about my feelings. And that's not it. You share what you want to share, but it's also about building a community of support. Also, all of our support group facilitators are trained by the organization, and either they're past caregivers or they work in this aging space. So they're a wealth of knowledge. So I also say it's a great education program that's not so tight, right? You get the resources you need. Somebody that is dealing with something. That maybe they dealt with a few months ago, maybe you're dealing with now, and they give you, what worked for them, and vice versa. So you help support your community, and really, again, it's about sharing resources and being around people that understand and get it. And we also know that, you know, there's a lot of different types of caregivers. I was talking with someone the other day. Maybe a caregiver is a neighbor, maybe they're a child. We see a lot of the sandwich generation, that is increasing tremendously, where you have an aging parent or a child at home, and their situations are going to look different than a spouse. The conversations about intimacy, um, about taking care of them, safety, is going to look a lot different for spouses. So we did develop a specific support group for spouses and partners that is held virtually by Jenny Luffman. She is a support group facilitator, but also professionally is a retired psychologist. So again, she was a caregiver, so a lot of information, very helpful. So again, that is very unique. We know that caregiver needs are unique, especially when there's relationship dynamics at work. Stephanie talked about our upcoming programs for the memory care, capable caregiving series. So I always like to include this flyer so you can join in next time and kind of see those topics and those dates. We are working with the Office of Dementia Services to facilitate our first Empowered Caregiver Program series. So it is in its entirety. I talked about a little bit about that earlier. So if you would like to join in, those dates are right there. And again, this will be sent to you. All this is virtual. So, and will be recorded. So if you do sign up and you're unable to attend, you will get the recording as well. And finally, I talked about our walk. It's our biggest support group of the year. You see that these dates have already happened. We are finally over with all of our walks, and they were just incredible. But I did want to leave this up because, I was a caregiver for my grandmother, and this was my 12th walk. And so I started doing this walkway before I was even employed with the Alzheimer's Association, but it was a way for me to celebrate my grandmother and our family to come together. It's not always, sunshine and rainbows, this disease, but these events, you see people smiling, you see people celebrating. And so, even if you don't fundraise, I always encourage people to attend our events because there's a lot of resources available. We were really excited to see Norton there this year. I saw Stephanie, and just the look on everybody's faces when they come in there is just incredible. It's an inspiring event. So again, we'll kick off our 2025 round next fall. And so again, I always like to talk a little bit about that because it will always hold a special place in my heart. But again, it's a wealth of resources and information as well. And then I guess we'll probably leave questions to the end. So I will kick it over to Tammy and stop sharing right now.
Yeah,
So
well,
thank you all.
perfect. Erin, thank you so much. Always good to see a kind of a recap of all you offer, lots of education and support. So while Tammy loads her screen, I want to tell you guys, you can utilize the Q&A function at the bottom of the screen. Submit your questions. We want to hear from you. We designed these programs for you, so we want to make sure we're meeting those needs. So any questions you have as it relates to these difficult conversations and what you're going through, Tammy and Erin and I can answer those for you at the end of the presentation. So go ahead and submit those in the Q&A throughout the presentation, and at the end we will get that going for you. So happy to have Tammy here kicking this off, this 3-part series. No better person to have this presentation than Tammy with her expertise. So she is a psychiatric nurse practitioner, a wealth of knowledge with dementia care. She's part of our NNI team serving at the memory clinic as well as Parkinson's and the movement side as well. But Tammy, thank you for being here, and I'm going to hand it off to you. You're muted. Ah.
All right, now I'm unmuted. Thanks so much for having me. I hope everybody can hear me okay now. Again, we're going to be talking about dignified approaches to difficult conversations today. And this is probably one of the things that I spend the majority of my time talking with families about. So this is the kind of first time that I've put this presentation together. So we're going to kind of walk through it together and see where we get to. All right, let's start by kind of talking a little bit about some of what the changes are that people experience in communication in general with progressing cognitive impairment and dementia. First of all, one of the big issues with communication depends upon sometimes the type of dementia that your loved one has been diagnosed with. There are many different types of dementia, as Erin mentioned earlier, only one of which is Alzheimer's dementia. There are also other types of dementia that involve more frontotemporal involvement, and some of those specifically can have really significant impact upon the ability to communicate, to use language, to understand what someone is saying to you, and to be able to express yourself verbally. So depending upon the type of dementia, there may be a whole unique set of experiences that people will deal with on a daily basis that have to do with communication. Additionally, if somebody has a vascular dementia and they've had a small stroke or a larger stroke or a little what's called TIA, those little mini strokes, if it is in the area or the regions that really impact communication and language, then that certainly is also going to be another issue that's going to impact how you can communicate with your loved one. And another thing that people often experience is that they may have a totally different ability to communicate about things depending upon the time of the day. It is very common for people to be more fatigued or more disorganized, restless, sometimes anxious, a little more confused later in the day. And part of that is related to just kind of fatigue. One of the examples that I frequently use with families and patients is that when your brain has changed as a condition of a specific dementia, then you have to concentrate and utilize your brain power twice as hard as everybody else just to kind of stay on task. And so it's sort of like, this is one of the ways that I try to help family members understand. It's sort of like if you were watching a movie that's not in English, and English is your primary language, but so you're having to kind of read the subtitles at the bottom of it. You're watching it and you can read, but you can't really look away. So you can't break your attention. You really have to focus. And by the end of a, 1.5, 2 hour movie, you might be pretty fatigued. It might have been a great movie. You might have really enjoyed it, but you're sort of glad that it's over with, that you can kind of break your attention and relax a little bit and don't have to be so focused and intent on reading the words. And in some ways that is similar to the struggle that people with cognitive changes and changes in memory feel on a daily basis. They have to work harder to stay on task and remember and organize and plan and do some of the things that are a little bit easier for anyone before any of those changes begin to take place. So, later in the day, when you're a little more fatigued, you've been focusing on things all day long, can look very different in terms of the ability to communicate and understand about specific topics. Fatigue, pain, and the environment are all things that can impact how well a conversation might go, particularly if it's about a topic that might be pretty sensitive. If you're uncomfortable or in pain, or if you're hot or you're cold or you're have clothing on that feels restrictive, or anything at all that could be impacting you in your environment. Maybe there's a lot of noise, or it's crowded, or you really just can't filter out things in the background. That can also change your ability to be able to focus and concentrate on the conversation that you're having. And additionally, not everybody has a primary language that they speak on a daily basis. Now, some people were raised speaking a different language, but they might use a second language on a more daily basis now. But as their cognition changes, they may revert back to mixing some of the languages, or revert back to their primary language as a daily use. Now, aphasia is a word that you might hear when people talk about some of the changes in communication with dementia. And basically, aphasia means there's a disorder of language. And it can come in different forms. One form is expressive aphasia, not really able to say things the way that you want. And that's kind of a general term. You just feel like there are things that you can't get out that are a struggle for you. And then there are receptive changes that people can have, where they feel like they're having a difficult time hearing what the information that you're presenting to them. They might feel like they're more slow, or they're just having a difficult time being able to hear the information that you're trying to give them. And sometimes that's another issue with hearing as well. And written language is also another thing that people can sometimes struggle with certain types of dementia. In a way, their eyes don't communicate with their brain quite as well. And so sometimes what they're reading looks different, and they may have a difficult time being able to communicate in writing. What are some of the other changes that we notice? Language changes specifically. One thing that a lot of people struggle with is not being able to find the right word. I do this myself. How many of you all do that? Probably everybody has their hand raised. But it can come in a more severe form for people that are struggling with cognitive changes and dementia. Not being able to find the right word that they want to be able to communicate adequately. And certainly that can come in some different forms. They may use a word that's related, but not exactly the word that they're trying to communicate with. And an example would be using the word book instead of the word newspaper. They may also use substitutes for words. For example, describing something rather than being able to actually name it. It's a thing that you sit on, but they can't pull the word chair out of their brain to be able to communicate effectively with you. And using words that have no meaning, or they're kind of jumbled up and in the wrong order, is sometimes something that people might struggle with as well. So the ability to converse can change. And one of the things that I always like to point out to family members is that's hard for you to recognize sometimes, because of the fact that these changes can happen so slowly over time that you really don't always notice them, or you're so close to that person that you overestimate how much they're able to understand, because you can't really look at them objectively because they're your family member. And you have a tendency to understand a little bit more background of what they may be talking about. And so sometimes it's difficult to really recognize their inability to understand words, or the decreased ability to process what's being said to you, and to recognize that there may be an inability to focus and to concentrate on the topic that you're talking about. Sometimes I notice that when I'm seeing families and patients in my office. The family member is trying to communicate things that they have concerns about, and they want to try to get as much information in as quickly as they can, because we all know time's limited with your medical appointments. And so in an effort to try to squeeze in as much information as possible, they might be speaking a little more rapidly. And pretty frequently, I can kind of see the person that's the patient is really feeling overwhelmed or anxious because everything is just coming out so quickly, and language, and everybody's speaking quickly and using words that seem complicated. And that can really be overwhelming for them. So what are some strategies that you can use? We'll get into some specific topics in a little bit, but what are some specific strategies that you can employ to have more successful communication and conversation with the person that you are a care partner with? So first of all, monitor yourself. And think about the topic that you're going to approach them with, and talk with your family, friends, their support system. Who is really going to be the best person to initiate this conversation? If it is something that you know could possibly elicit anxiety or agitation or anger or paranoia, then who do you feel like is the person that's going to be best equipped to proceed with that conversation? And in some ways, maybe that might be a good friend instead of a child, somebody that they feel like they can trust and that they have good rapport with. Be aware of your body language. Make sure that you make good eye contact. And in terms of body language, make sure that you're on their level, that you're not standing above them while they're sitting in a chair at the table, because that feels kind of condescending, just above or authoritative. Try to be on their level and try to create a relaxed atmosphere. And don't rush the conversation. Try to stay calm, and try to use short, simple sentences and speak slowly. Again, it is very difficult sometimes for them to follow the information that's coming into them, because they just process things more slowly. And make sure that you're not speaking to them in a way that they would perceive as condescending, or that you're talking to them like a child or somebody that is younger or not an adult. And try to engage in such a way that it's more conversational rather than asking them a whole lot of questions. Sometimes it's difficult for them to follow the train of your conversation and to stay engaged and to respond with questions. Again, we talked a little bit already about controlling the environment. Try to minimize distractions, no loud noises, not lots of people walking around. Taking somebody out to a restaurant that's really busy to have a conversation about driving safety, probably not a good idea. But make sure that you're in a setting that's comfortable and you can minimize distractions. Try to create kind of the atmosphere that's going to be quiet, calm, minimal lighting. I mean, don't make it dark, but to try to not have bright lights pointing at somebody so they don't feel like you're interrogating them. And then think again about the best time of the day. When are they at their best? If you know that there's a specific time of the day that they tend to be more fatigued or more anxious or more stressed, then let's don't use that time of the day to have a conversation. Think about things like, are they hungry? Are they thirsty? Is there anything else that I need to address? Do they need to go to the bathroom? Before we kind of begin this conversation. And then also think about the number of people that are there. Having all the family around sometimes is a great approach, because you can kind of show a sense of caring and continuity and All of the family is really invested in doing what's best for you. And we want you to understand that this is what we think might be best, but also be aware of the fact that that could feel like you're being ganged up upon and everybody's against you, and it could kind of go the opposite way. It depends upon the person. And monitor their response. How is their body language? Do you notice that they're changing positions, that you can see that they're frustrated or they're anxious or they're angry? Do they look like that they are able to pay attention and be engaged? Or can you read from their body language that this is not a conversation, that they want to continue and maybe you need to back off a little? Make sure that they can hear what you're saying and that they can see and be engaged with you. And make sure that you listen and acknowledge their feelings and use language that validates how they feel about the topic. I know this is a difficult conversation. I know this is a difficult thing for us to think about. It's hard for me too, and I hear that this is difficult for you. Those are some good types of language to use to kind of validate concerns. And monitor for their fatigue. If it looks like the conversation is going on too long and you've exceeded their ability to kind of tolerate that frustration, or they're getting too anxious, then maybe it's time to kind of wrap it up and move on. And then consider the content of the conversation. Sometimes people that begin to have cognitive and memory changes will have a misperception of reality. They may interpret some things that you're talking with them about, like concerns about finances because of risk for scam or being taken advantage of, as believing that you're trying to take their money rather than protect their assets. So be aware of the fact that they may have some misperceptions about what is really being talked about, and try to be aware of that as you broach certain topics. And then think about, as they're responding to the conversation, have maybe you overestimated their ability to really actively participate in the conversation that you've initiated based upon their judgment and their insight and their ability to participate in the conversation. Again, that can be really common because you're so close to the person. You can really overestimate sometimes their ability to understand some of those topics. What are some of the difficult topics to discuss? Well, I think everybody's probably pretty familiar with these. These are some of the more common ones that I encounter with families on a daily basis. Number one is probably just general concerns about memory loss. How do you bring that to somebody's attention if you've noticed it? How do you just begin the subject of, you've asked me the same question 6 times already since I've been here. Talking with them about going in for a memory evaluation. How willing are they to even consider going in to see a healthcare provider for a memory evaluation or checkup? And keep in mind that this big word is one of my favorite words, anosognosia. And so what that means is their ability to participate in a conversation about their memory and the procedure that you go through to clarify diagnosis or explore that can be impacted by this phenomenon or condition called anosognosia, which means that you literally lack the ability to recognize your own impairment. You have no sense or awareness and can very frequently become defensive, argumentative, or paranoid about someone bringing that subject to you. They might be very defensive and say, I'm perfectly fine. I can manage all my own bills, but their water's been turned off and their LG&E is about to be turned off because they haven't been able to manage their bills adequately. Driving safety, obviously, is another big topic and can be concerning. talking to somebody about looking at a driving evaluation, to do that in a more professional setting with one of the driving programs, which the Cressman Center here at the Neuroscience Institute does have a driving evaluation program that's very objective and can give very concrete feedback about safety and judgment and insight with operating motor vehicle. And then do you need to talk with them about maybe just some restrictions, or do you need to have the conversation about stopping driving or driving cessation? Talking about establishing a decision maker, somebody that can be a power of attorney for them. Talking about securing important paperwork, like where are those things? There are times when family members change or their health issues change or a spouse passes away, and then the adult children are left trying to kind of find paperwork for someone who has memory impairment, and they don't know where anything's at because mom or dad kind of always took care of everything. So talking with them about where their important papers are located and how you can best support them in the event that something changes as far as caregivers in their lives. And finances, managing finances is a big conversation. Talking about the possibility of being a financial power of attorney for someone, or concerns about any kind of risk for being a victim of, financial scams or, telephone scams. We have numerous patients just since I've been here that have fallen victim to that, and I've almost been at risk for that myself. Sometimes I don't know if some of those messages or telephone calls that you get are real. Another difficult conversation that you may have to approach is, what is the final diagnosis? Once you do come in and you're evaluated, what is the diagnosis? How do you present that for them? Do they have a diagnosis of mild cognitive impairment that may or may not progress? Or do they actually have a diagnosis of a form of dementia? How is that topic approached? The ability to live independently is also another very difficult topic to approach with someone. Are they able to still manage their personal hygiene? And sometimes people get very offended if you notice that they haven't been bathing regularly or changing their clothing regularly. That can be a very difficult conversation to have in terms of asking about hygiene or changing clothes, or how can you approach that conversation while maintaining their dignity and not offending them in any way. What about the cleanliness of their home? Do you notice that things are stacking up, that there's a lot of kind of hoarding of items, or there are things that might create difficulties for safety in terms of getting in or out of the house? Falls risks, kind of clutter and things that might be concerning. Are they able to manage their dietary needs? Can they still get food into the home? Do they recognize their ability or their need to have meals consistently? Are they losing weight? Can they safely prepare food in the home, or has cooking changed for them? And are they still able to manage daily medications and medical appointments? Calling in refills to the pharmacy, making sure that they've got appointments on the schedule or on their calendar, and are they getting to those appointments regularly so they can maintain labs and medication refills and monitor their daily health? And then discussing goals of care and future planning. And that can involve things like advanced directives. What type of care do they want? What types of things might they not want to be pursued if they have a decline in their health? And talking about something called aging in place versus a more structured community that has different levels. So ultimately, that would be kind of moving out of your home. Do you want to stay in your home, even if cognition continues to decline? And let us try to bring caregivers here to you to keep you in the home. Or would you prefer to look outside of the home and move someplace where you can be in a setting that has different levels of care so that they're able to meet your needs in the same place or on the same campus? So how do you approach some of these things? So some strategies that I've kind of thought about is, I've noticed that our memories aren't as good as they used to be. Do you ever worry about your memory? Maybe we should think about considering a thorough medical checkup and ask about things that we can do to keep our memory good, including yourself in the conversation, and talk about going to an appointment with someone can sometimes ease into that conversation. Another thing that's very helpful for healthcare providers is if you are able to provide them something in writing that you can kind of slip to them before a healthcare appointment. Sometimes if you do that at the time of check-in and say, I'd really like the physician or nurse practitioner or physician's assistant to be able to read this before they meet with mom or dad, it can give them a little bit of insight into why we're here today. And that can sometimes facilitate or allow the provider to lead communication in a little bit different path. And it might take a little bit of the heat off of you as well, so that you don't have to introduce the subject or concerns about memory. Now, here's another one. You know that I love you, and I want to make sure that you're safe. And I'm worried about your safety when you're driving. I know that you'd be devastated if you caused an accident that harmed someone. So can we talk about driving? It might be that they're pretty receptive to that. It might be that they're not receptive at all. And you might want to be able to talk to them about, maybe only driving in certain areas that you're familiar with during the daytime. Don't get on the highway, or high traffic areas, or don't drive at night. Make sure that you're only driving in areas that are safe and that you can navigate more reasonably. You might also use language like, I'd like to make sure that your decisions regarding your medical care are honored in the event that something ever happens. And can we make sure that you have all the paperwork in place? And I'd also like to make sure that your assets are protected and they're safe. So let's make sure that we know where all your important financial and legal papers are located. And do you have any thoughts about who you might want to designate for your financial or medical decisions? This is some ways that you might be able to kind of formulate language that can come off in a less threatening or authoritarian type of a manner. Discussing a final diagnosis should include your healthcare provider, if at all possible. We want to be able to answer questions for them regarding potential progression of illness and treatment, and how to proceed, what kind of steps would be important, and answer any questions that you might have. So discussing the implications of the diagnosis and future planning will be more of a family discussion with guidance from the memory specialist and community resources. So you might want to use language like, I know that this diagnosis is a lot to think about, and I'd like to help you discuss and make plans for what you'd like to see happening in the coming years. If your ability to live at home changes, what would you like to do? Would you like to try and bring people into the home to help, or would you like to look at other living arrangements? I'd like to make sure that I know what your wishes are. Maybe we can seek some professional help from some elder specialists to discuss options and planning. Maybe the memory clinic can give us some suggestions. That might be a good way to kind of frame conversation. There is not a perfect answer to everything. And obviously, some of these strategies are not going to work. And there may be times that people are very resistant to these conversations regarding diagnosis and safety concerns and living independently and just even going to talk to somebody about their memory. So, what if they're not receptive to discussion about driving or alternative living arrangements, but you know that safety concerns require that something happen urgently. They have to get to the doctor, or something has to happen in order for them to be safe. So that can be impacted by a lot of different factors. Probably the most important one is really what stage of dementia is the person at? Are they still in an earlier or milder stage of dementia, and you have concerns about their safety, but you still are able to come into the home and to help with supervision of setting up medicines or being of assistance, and they're willing to allow you to do that? That's a different scenario than somebody that lives independently, and the home is very cluttered and unsafe, or they are wandering away from their home or driving and really don't have the ability to find their way back home anymore. The stage of dementia and the severity of the safety concerns really will have a significant impact upon how much pressure you really have to put on them to begin to have these conversations. And there are times that some people will have such a level of impairment or paranoia or a lack of insight and judgment that you may have to pursue legal guardianship. And that's not always an easy process. It can be complicated and stressful, and sometimes it can create a lot of animosity. That is something that that the social workers and our resource center can at least help you talk with some about the process of that and kind of get you pointed in the right direction. Occasionally, people may have to actually contact Adult Protective Services if someone is very resistant to allowing your assistance, moving towards more of a legal guardianship situation, or allowing you to help clean up the house, or any situation where you know that they are really at great risk, and you may have to call Adult Protective Services to come into the home, evaluate your concerns, and to give you suggestions or advice about how best to proceed. And sometimes it does require, sometimes those instances are required to at least get you in the direction of moving towards legal guardianship. Now, utilizing a little more discrete strategies can also be of service. There are times, I had a great uncle who was safe driving, and he was not receptive to the conversation about driving. And his level of dementia at that point was not, was significant to have a reasonable conversation with him. And so I can't remember who it was, but somebody came up with the great idea of taking the spark plugs out of the car. And he won't be able to start the car, and we'll just kind of drag it out, and the car just won't start. And there won't be anything for him to drive. So they lived in the country, and so he went out, raised the hood of the car. Of course, it wouldn't start, so he raised the hood of the car, and he said, "You're not going to believe this. Somebody took spark plugs out of there." So All he did was he called the local auto shop because everybody knew everybody in the country, and somebody brought him some new spark plugs. So that doesn't always work either, but sometimes there are instances where you may have to do things like disable a car or modify a little bit of what reality is in order to assist you with moving in a direction for creating a more safe environment for that person. And sometimes it is safest to blame the healthcare providers or the legal system or whomever they are to take a little bit of the heat off of yourself because of the fact that you're there with them all the time. And if they are repetitive or have short-term memory loss and they're constantly focused on you, in terms of the person that took away some of the things that they think are really important, it's a pretty miserable situation to be in, to always be the brunt of their anger or frustration. So if you can kind of say, you know, it wasn't me. I don't think it's a good idea for you to be driving or living alone or whatever the situation is. But, you know, I'm not the one that made that decision. It was Dr. So-and-so, or it was the court system. And sometimes that can be a helpful strategy to kind of begin to take a little bit of the heat off of yourself. So I hope some of these examples of ways to frame conversations and approach difficult topics have been helpful for you. I've had some of these conversations with family members and patients. And if there are questions that we might be able to answer for you, then send them in and maybe we can answer them today. Or if you can bring your family member in, these are some of the things that we deal with on a daily basis in terms of helping families and patients make decisions about safety and future treatments.